Have you ever ignored a strange feeling in your stomach, thinking it was just stress, indigestion, or something you ate? Most people do. A little bloating, a little pain in the back, sudden tiredness, loss of appetite. It all seems harmless at first, but sometimes your body is trying to warn you about something much more serious. And one of the most dangerous diseases often begins this way, quietly, without dramatic symptoms, without loud pain. Pancreatic cancer is often called the silent killer because many people don't realize something is wrong until the disease has already advanced. But today, I want to talk to you about warning signs that should never be ignored. Some of these symptoms may seem small, some may look unrelated, but together they can reveal important clues your body is trying to send. And no, this video is not here to scare you. It's here to help you become more aware of your health before it's too late. So please stay with me until the end, because one of the final warning signs surprises even doctors. Let's begin. First, unexplained weight loss. Have you noticed your clothes becoming loose lately? Are you losing weight without dieting or exercising? Many people feel happy at first when the scale drops, but sudden weight loss without a clear reason can sometimes be a warning sign that the body is under serious stress. The pancreas plays a major role in digestion. When it doesn't work properly, your body may struggle to absorb nutrients and maintain weight, and this weight loss often happens quickly. Second, pain in the upper abdomen or back. This is one of the most commonly reported symptoms. At first, the discomfort may come and go. Some people describe it as a dull ache. Others say it feels like pressure deep inside the body. What makes it confusing is that the pain often spreads to the back. People think it's muscle tension, bad posture, or simple aging. But persistent pain around the stomach area that radiates into the back should never be ignored, especially if it keeps returning. Third, yellowing of the skin or eyes. This condition is called jaundice. Sometimes the skin becomes slightly yellow. Sometimes the eyes change color first. Many people don't notice it immediately. This can happen when a tumor blocks the bile duct, causing bile to build up inside the body. And often, jaundice appears before any major pain begins. Some people also notice dark urine or pale-colored stool around the same time. Fourth, sudden loss of appetite. Have you ever looked at your favorite food and suddenly felt no interest in eating? That is not always normal. People with pancreatic problems often report feeling full very quickly, even after eating only a small amount. The digestive system begins slowing down. The body changes the way it processes food, and over time, eating becomes uncomfortable. Fifth, nausea and digestive problems. This symptom is easy to ignore because many conditions can cause stomach discomfort, but persistent nausea, frequent bloating, or feeling sick after meals may sometimes signal that something deeper is happening, especially if these symptoms continue for weeks. The pancreas helps produce enzymes that break down food. When that process is disrupted, digestion becomes harder, and the body begins reacting. Sixth, extreme fatigue, not ordinary tiredness, not the kind that improves after sleep. This is the type of exhaustion that follows you throughout the day. You wake up tired, you feel weak without explanation. Even small tasks become difficult. Many serious illnesses affect energy levels because the body is constantly fighting internal stress and inflammation, and pancreatic cancer is no exception. Seventh, new onset diabetes. This surprises many people. In some cases, diabetes appears before pancreatic cancer is discovered. Why? Because the pancreas is responsible for producing insulin. If the pancreas becomes damaged, blood sugar levels may suddenly rise. Some people notice intense thirst, frequent urination, blurred vision, or unexplained hunger. And for older adults especially, sudden diabetes without family history should be evaluated carefully. Eighth, itchy skin. Most people never connect itching with internal disease. But when bile builds up in the bloodstream, it can irritate the skin and cause severe itching. Sometimes there is no rash at all, just persistent itching that seems impossible to explain. Ninth, blood clots. This symptom is less obvious but medically important. Some people develop swelling or pain in the legs due to abnormal clotting. Others experience sudden shortness of breath if a clot travels to the lungs. Cancer can sometimes increase the body's tendency to form blood clots, and doctors take unexplained clots very seriously. 10th, changes in stool. This may feel uncomfortable to talk about, but your stool can reveal a lot about your health. Greasy stool, pale stool, floating stool, or unusually foul-smelling bowel movements. These changes can happen when the pancreas fails to release enough digestive enzymes. As a result, fats are not properly absorbed, and the digestive system begins malfunctioning. 11th, persistent bloating. Everyone feels bloated occasionally, but chronic bloating that does not improve, especially when combined with pain or appetite loss, should never be ignored. Many patients later diagnosed with pancreatic disease say they felt something wasn't right for months before seeking help. Please listen to your body. And finally, the 12th warning sign, a feeling that something is deeply wrong. This may sound strange, but many people describe an unexplained internal feeling before diagnosis. A sudden decline in strength, a constant sense of illness, or simply feeling unlike themselves. Never ignore dramatic changes in your body. You know your body better than anyone else. Now listen carefully. Having one or even several of these symptoms does not automatically mean cancer. Many common conditions can cause similar problems. But when symptoms persist, when they worsen over time, or when multiple signs appear together, it is important to speak with a doctor. Early detection saves lives. And unfortunately, many people wait too long because they assume the symptoms are harmless. Please do not make that mistake. Take care of your health. Pay attention to the signals your body sends you, and encourage the people you love to do the same, because awareness can make all the difference. Thank you for watching until the end. I truly hope this information helps someone recognize an important warning sign early. Take care of yourselves and your loved ones. Stay healthy, stay strong, and never ignore what your body is trying to tell you. And if you found this video helpful, subscribe to the channel and join our community for more health information designed to help you live a longer, healthier life. See you in the next video.